Asbestosis. It's a word that sends chills down your spine, and rightfully so. It's a serious lung disease, and it's entirely preventable. Asbestosis is a chronic lung disease. It arises from inhaling asbestos fibres. Picture these fibres as tiny, microscopic needles. They lodge themselves into the delicate tissues of your lungs. Over time, these fibres irritate and scar the lung tissue. This scarring makes breathing difficult. It's like trying to breathe through a straw. The process is gradual, often taking years, even decades, for symptoms to surface. Imagine a slow, insidious process silently chipping away at your lung function. Asbestosis belongs to a group of diseases known as interstitial lung diseases. These diseases affect the interstitium, the delicate network of tissues that surround the air sacs in your lungs. This intricate network is responsible for the vital exchange of oxygen and carbon dioxide. Think of your lungs as delicate sponges. Asbestosis is like pouring glue into that sponge. It stiffens the sponge, making it harder to absorb air. This is why people with asbestosis experience shortness of breath, especially with exertion. Asbestos isn't some rare, exotic substance. It's a naturally occurring mineral. And it was widely used in various industries for its strength and heat resistance. Think construction, insulation, and even shipbuilding. Workers in these industries faced, and some still face, significant exposure risks. But it's not just about occupational exposure. Think about older buildings with asbestos-containing materials. Renovations or demolitions can release these fibres into the air. This poses a danger to workers and occupants alike. It's important to remember that asbestos exposure isn't limited to direct contact with the material. Secondary exposure is a real concern. Imagine a construction worker coming home covered in asbestos dust. Their family members, especially children, could inhale these fibres, unknowingly putting their health at risk. This emphasizes the importance of stringent safety regulations, proper handling procedures, and raising awareness about the hidden dangers of asbestos. It's not just about protecting workers, but safeguarding entire communities. Recognizing the warning signs. Symptoms of asbestosis. Asbestosis is a silent stalker. Its symptoms often take years, even decades, to manifest. This makes early detection a challenge. Common signs include shortness of breath, especially with physical activity. Imagine struggling to catch your breath after climbing a flight of stairs. That could be an early warning sign. A persistent dry cough is another red flag. It's not your typical cold or flu cough. This cough is relentless, often accompanied by chest tightness or discomfort. Imagine a constant tickle in your throat, urging you to cough but providing no relief. As the disease progresses, you might notice a crackling sound when you breathe. This is called rales, caused by the stiff, scarred lung tissue rubbing together. Imagine the sound of Velcro being pulled apart. That's similar to what rales sound like. Other symptoms include fatigue, weight loss, and clubbing of the fingers where the fingertips widen and the nails curve. These symptoms, while not exclusive to asbestosis, warrant immediate medical attention if you suspect exposure to asbestos. Seeking answers. Diagnosis and early detection of asbestosis. Diagnosing asbestosis is like piecing together a complex puzzle. It starts with a thorough medical history. Your doctor will ask about your work history and symptoms. Next comes a physical examination. Your doctor will listen for abnormal lung sounds. Imaging tests like chest X-rays and CT scans are essential. They reveal any scarring or abnormalities. Pulmonary function tests measure lung capacity and efficiency. These tests provide valuable data on your lung function. Navigating asbestosis, treatment and management strategies. There's no cure for asbestosis. The damage is irreversible, but that doesn't mean there's no hope. Treatment focuses on managing symptoms, slowing disease progression, and improving quality of life. Think of it as a multifaceted approach to living your best life despite the diagnosis. Oxygen therapy is often prescribed to help you breathe easier. It involves breathing supplemental oxygen through a mask or nasal cannula. Imagine having a portable oxygen concentrator that allows you to stay active and engaged in your daily life. Pulmonary rehabilitation is another crucial aspect of management. It's a personalized program that combines exercise, education, and breathing techniques to strengthen your lungs and improve your overall well-being. Think of it as physical therapy for your lungs. Medications like bronchodilators and corticosteroids can help open up narrowed airways and reduce inflammation. They provide relief from shortness of breath and make breathing easier. In severe cases, a lung transplant may be an option. This is a major surgery that replaces your damaged lungs with healthy lungs from a donor. While it's not a cure-all, a lung transplant can significantly improve quality of life and extend lifespan.